Hi, I'm Dr. Buonasissi. I thought today I'd talk a little bit about neck lifts. This is something that I get a lot of questions about, and my office staff gets a lot of questions about via email and via phone calls from patients. There's lots of different ways to manage the neck and things that we can do to improve the shape of the neck. A lot of it has to do with a person's underlying anatomy, but also I think you have to take into consideration what can be modified and what can't. So I want to talk through a couple of different ways of improving the shape of the neck, starting off with what we call a deep neck debulking or a deep neck lift. And that's an isolated procedure that allows for the neck to be tightened and made sharper without actually having to remove any skin. So it's ideal for patients who don't have a lot of loose skin or don't have other signs of facial aging, but really have an isolated shape issue with their neck. So here's an example of that. Here's a patient who has really beautiful facial features. She's a little bit obtuse in terms of the angle of her neck. So you can really see that from the side view that her neck takes on a fairly obtuse angle as it heads from the submental crease down to her neck. This is after a deep plane or a deep debulking of her neck to reshape the contour. So that really gives her a very youthful, fit, sharp-looking neck without having to necessarily remove any of her skin. So I think this is a great way to improve the shape of the neck in our younger patients. Now, it's really important to determine or to differentiate this from liposuction. It is not that at all. And I'll go through that with some diagrams in another video, but this is debulking the fat layers, some of the muscle layers, even some of the glandular tissue in the neck, so that the neck muscle can be tightened, and it has to have a place to go. So liposuction alone just removes a little bit of the surface fat under the skin. This is a very different surgery, so it's not equivalent at all. So on the topic of neck lifting, other types of anatomic variations require a different type of surgery. So we talked before about debulking the neck in patients who don't necessarily have age-related changes, but shape issues that they would like to correct. There are situations where the neck was a good shape at one point, but because of laxity and exposure to gravity over the years, the skin starts to sag and makes the neck look more obtuse because of looseness. So here's an example of that. This patient is a little bit older than the one we had before, and you'll notice that she's kind of got some vertical descent, not only of the neck tissues, but also of the rest of the face. And so this is actually a facelift that I did here. This is a deep plane facelift where the muscular layers are pulled in a more vertical direction, and that manages the neck, the jawline, and the cheeks as well. And you can still get a very nice improvement in the neck. You can see on these views, you can see on this view as well. And that's not debulking the neck. There wasn't anything there. That's just looseness. There wasn't any fat or excessive muscular structures underneath. So that was suspended in a vertical direction. And I think it helps her because it rejuvenates the other parts of the face as well. So that's an isolated deep plane facelift, which definitely improves the neck in most, but not always. Sometimes you also have to do a debulking of the neck in those types of patients. So I'll show you an example of that. This patient has a very full neck. You can see on these views that in addition to having that obtuse shape where there's a bit of extra bulk in the neck, she also has a bit of descent of some of the other tissues. So we wanted to sharpen up the jawline, elevate the cheek, but also sculpt the neck and debulk that. So this is a combination of the deep neck debulking and deep plane facelift. So there's lots of sort of ways of combining these procedures. Ideally, we want to do just the procedure that's going to give the best possible result. But in a lot of cases, we end up doing several procedures to try and achieve a result that's kind of in balance for the whole face. So if it's just the neck, we just do the neck. But if it's the neck and the face, then we often combine both of those surgeries, and they can be done at the same time, ideally. So as I've mentioned before, I'm not a huge fan of liposuction because I just don't think it's particularly effective, but there are cases where I think it can help as an adjunct. as a standalone procedure, I don't think it really benefits people to the degree that they want or that they imagine. So here's an example of a case where I did do some liposuction in addition to a deep neck debulking. And I find that the liposuction is helpful for contouring a little bit under the jawline, or just to sort of feather the debulking more laterally. But you'll notice in her that she's a bit full kind of underneath the neck, and that's improved after the surgery. This is her 3/4 view. And I did do a little bit of superficial liposuction out here to try and improve some of the definition along her jawline. But liposuction itself doesn't tighten anything. It's a very passive procedure. It just removes a bunch of fat, and then you kind of hope that with less fat underneath the skin, that the neck is going to contract upwards. And I don't think it really does that. So in a case like hers, you can see there's a tiny little incision underneath there. But what I did in her is I debulked her neck, like I showed you before, taking large amounts of fat from underneath the muscle, tightening the muscle, and then I used liposuction just to kind of sculpt things a little bit. I don't think it does much beyond that, in my opinion. So I think the last situation I can think of, I might think of some others down the road, but there are some cases where there's maybe a little bit of fat, but not a lot. But there's a little bit of looseness of skin perhaps in the neck that I don't think a debulking procedure is going to sort out. Also, there are many patients who just don't need a facelift, so we're sort of stuck in the middle, you know, where there's situations where there's fullness, a little bit of loose skin, but not really facial aging changes elsewhere. So it's a bit overkill to do a facelift in a case like that, but I don't think the debulking alone is going to sort out the extra skin. And this is where we sometimes will do a Z-plasty. So a Z-plasty, we call it that because the flaps are rotated in a Z fashion, and you can sort of see a final scar that's a Z. But this is a situation where, in addition to some bulk, and you can kind of see there's a bit of fat underneath there that needs to go, she does have some extra skin there. And she's quite young and doesn't need a facelift. So in her case, we did a Z-plasty. And so you'll notice on her side view that she gets a very sharp neck. She's got a nice angle. There's really not any reason to do a facelift on her. She's quite young. She's got a nice jawline. So I think that this is a situation where I don't think debulking or liposuction was going to solve the problem for her. So in her case, in addition to taking some of the fat out, tightening up her muscle, I also removed some skin. With a facelift, you'd be removing the skin out towards the sides, if that's necessary. But in a case like this, we remove it directly. It's less common for sure because there is a scar that results from it, but some people are accepting of that scar, particularly men. So I think it can be a useful procedure in a small number of patients, as long as they can accept that they'll have to have a little scar there. So in our practice, I find it very helpful to educate patients prior to seeing me about what some of the options are. So our process is that patients will contact our office and speak to our consultants about what they are interested in having done. A photo review done by me is also very helpful. So if patients don't mind sending in a photo on a few different angles, I can assess from the photos what I think they're likely to need. And I think if somebody sends in a photo and says, you know, I really want to have liposuction to fix my neck, but they have a really loose neck and they've got a jowl and descent of the cheeks, you know, I'm probably going to warn that patient that liposuction isn't going to be an option for them. And I think it at least sort of sets the tone prior to coming to see me that what they'll probably require is something different than what they think. As a patient, you're not expected to know what surgical procedure is right for you. You might think that liposuction is the way to go. You might think that a facelift is the way to go. But there's actually lots of different options, and I think it's nice if I can have a look at your photos first, give you an idea of probably what I'm going to recommend, and you can even find out the cost for these things first as well. And I think it just saves a lot of time and also allows me to have a consult with patients focused on what we're trying to achieve rather than answering questions or dispelling misconceptions that they might have in advance.